Okay, now the inguinal region. So here the pictures of inguinal canal. Okay, here this is the picture of the inguinal canal. So what we can see here, inguinal canal extended from the anterior superior iliac spine, which is situated here, and the pubic tubercle situated here. So anterior superior iliac spine and the pubic tubercle, there is an oblique line which extended from anterior superior iliac spine to pubic tubercle. This is called the inguinal region, and the content is inguinal content. This is the inguinal content, and the canal it forms, it is called the inguinal canal. So inguinal region containing a inguinal ligament which hold the inguinal content. So inguinal ligament which is extended from anterior superior iliac spine to pubic tubercle. Okay, now the how it forms and what is the boundary of the inguinal canal. So inguinal canal has three intersegmental area, that is medial 2/3, then medial 2/3 and lateral medial 1/3, then medial 1/3, medial 1/3, lateral 1/3. Okay, so by this way this ligament is already divided, that is it acts as a matchbox. If we see the boundary of the inguinal ligament, it is act as a matchbox. You can see the layers, it is called the external oblique aponeurosis, which comes then forms a inguinal ligament, that is anterior wall of the inguinal ligament which is formed by the aponeurosis of external oblique. Okay, so this is the aponeurosis of the external oblique, and then you can see the middle, from the middle part up to the laterally. So midpoint to lateral point there is a two muscles you can see here, that is called the internal oblique and transversus abdominis. Okay, so this is called the internal oblique, this is called the transversus abdominis. So these two ligament forms the roof of the inguinal canal. That is, if we divided it into medial 1/3 and lateral 2/3, so if we imagine that this is the lateral 2/3 and this is the medial 1/3, so medial 1/3 is formed by the conjoint tendon. Why it is called the conjoint? Conjoint means these two muscles will reunite with each other and forms the conjoint tendon. So conjoint tendon containing both internal oblique and transversus abdominis. Okay, and medially there is another muscles which is derived from internal oblique, it's called the cremasteric muscles. You can see cremasteric muscles originated from the internal oblique. Okay, so teachers sometimes ask you the questions of where cremasteric muscles is originated. So cremasteric muscles is originated from internal oblique. So now this forms the roof of the inguinal canal. Now the posterior wall of the inguinal canal is formed by the medial 2/3 and lateral 1/3. Okay, so medial 2/3 and lateral 1/3, that is medial 2/3 forms the fascia transversalis. Okay, so posterior wall of the inguinal ligament form the fascia transversalis and conjoint tendon. So fascia transversalis forms the posterior wall of the inguinal ligament, and the lateral part of the, that is lateral 1/3 of the inguinal ligament is formed by the transversus abdominis muscle. That is, here you can see the transversus abdominis muscles here. So transversus abdominis, part of the transversus abdominis and fascia transversalis, that forms the posterior wall. Okay. So this is the boundary of the inguinal ligament. So what is the content of the inguinal ligament? That is a spermatic cord. The spermatic cord along with the testicular vessels, lymph node, and some fat. Okay, here you can see the spermatic cord, that is, it contains vas deferens, testicular artery, pampiniform plexus, that is vein, testicular vein, and some lymphatics and fat. It contains the full content of the inguinal canal. So here, so inguinal canal, that is, this canal has two ends. One is superficial inguinal ring, another is deep inguinal ring. So deep inguinal ring and superficial inguinal ring. So superficial inguinal ring, which is formed by only and only external oblique aponeurosis. Here you can see this is the superficial inguinal ring, which is formed by only external oblique aponeurosis. But the deep ring, that is deep inguinal ring, which is formed by the fascia transversalis. Here the internal spermatic fascia form the fascia transversalis at deep inguinal ring. So deep inguinal ring is formed by the fascia transversalis specially. So the formation is very important. What are the nerves that passes through the inguinal ligament? The question is ilioinguinal nerve. Ilioinguinal nerve goes through the inguinal ligament. There are two additional nerves, ilioinguinal nerves. Ilioinguinal nerve goes through the inguinal canal solely, but the another nerve, that is genital branch of genitofemoral nerve, is also passes through the inguinal canal. And there is another question, that is the layers of the testis, the layers of the scrotum from above downwards. So for before backwards, you have to explain the layers of the scrotum, that is skin, tertos muscle, then external spermatic fascia, chymesteric muscles, internal spermatic fascia, and the tunica vaginalis of the testis, that is outer visceral layer of the testis. So this question is also asked in the exam. So here what we learned, that content of the inguinal ligament, boundaries, and the nerves, that is ilioinguinal nerve, genital branch of genitofemoral nerve. Okay, that is it.